The symptoms are similar, and perhaps that's why many people think flu and colds are the same thing, but they're not. The flu, when not treated correctly, can cause complications like pneumonia, lung infections, and can even lead to death. Therefore, it's fundamental to differentiate the two diseases to provide more severe treatment if necessary. But what's the difference between flu and cold? Difference between flu and cold. What is a cold? A cold is an infection caused by viruses that affects the respiratory tract. The main symptoms appear about 3 days after contact with the virus. It can enter through the mouth, eyes, or nose. Main symptoms of a cold. The symptoms of a cold are very similar to those of a flu. Generally, the patient suffers with runny nose, which is a transparent nasal secretion, cough, very low fever, and a little tiredness. The diagnosis of the disease is made based on the patient's symptoms. Generally, after 3 or 4 days from the appearance of symptoms, a good improvement in physical conditions is noticed. What is a flu? The flu is also a disease caused by viruses, like influenza A and B. Transmission happens through the respiratory tract by inhaling contaminated particles from the air. Main symptoms of flu. Flu carriers suffer with high fever, generally above 38.5 degrees Celsius, strong body aches, throat pain and inflammation, cough, headaches, thick secretion, phlegm, weakness, lack of appetite. The flu can evolve to cases of pneumonia or more serious infections when not treated. The incubation period can take up to 6 days, and symptoms can remain for several days. Main differences between flu and cold. In the flu, fever is very high and the condition can evolve to more serious infections, and the patient still runs the risk of death when the disease is not treated correctly. The cold is much milder, being treated only with medications to relieve symptoms. In case of doubts, always consult your doctor.